So now I'm going to show you how to now incorporate the cupping, but through massage. So again, as always, you're going to use a massage medium that you feel most comfortable with, whether that is wax, oil, lotion, etc. So you will have done lots of treatment to this area already. Remember, cupping tends to sit nicely alongside your other techniques. So you'll have loosened off the area as much as you possibly can, feeling where you want to be, and at that point obviously it's going to give you an indication of why you're using cupping in the first place and what you're trying to achieve. So I'm going to use a smallish cup. I'm just going to put one pump on there, and then again I'm going to start to work through that area. Now I can feel there's quite a bit of tension on there. Now here feels like it's sliding quite nicely, but as I come around the front and down, it's quite tense. So can you feel the difference there, Laura? It feels quite tight there. So with regards to the tight areas, you do just need to make sure that that's not painful to your patient. And if it is, then you need to ease it off. So whilst it might slide nicely around the back, the area that's the cup is actually highlighted you need it to be, where it's tightest, that's the area that you're going to be working, so you need to make sure it's comfortable for your patient. You can always add more pressure later, but obviously to start with just at a level that your patient is comfortable with. Okay, and then just working through that area, just as you would any other area. You can work longitudinal. There we go. We can work transverse. You okay? And then when we find those tight spots, we can leave one just there, and then we can get a second cup and work around if we wish to, so that we're not stopping treatment, we're actually continuing it whilst focusing on the areas that need a little bit more. Now as I come around the anterior shoulder, just be mindful that this area is quite sensitive to cupping, and what I mean by that is often, just like the upper traps, this area can become quite pink and quite pitted with the blood spots that we saw earlier. So that's quite normal if it does that. Just be mindful of pressure, because it can be quite a tender area, so we want to just be mindful of how much we go through. And if as soon as you start to see a reaction, if you see a reaction, obviously leave that alone and move on to the next bit. So if I'm finding that's quite tight there, I'm going to leave that one there, and then I might start working through that spot again. There we go, just reassessing how that now feels. Happy with that. So once I'm finished, I'm just going to remove the cups and leave it there.